How does colposcopy diagnose cervical changes? Imagine your doctor needing a closer look at your cervix to understand what's happening beneath the surface. That's where colposcopy comes in. It's a detailed examination that helps identify abnormal cervical tissue, especially after abnormal Pap smear results or positive HPV tests. The process begins with the doctor inserting a speculum to gently open the vagina, giving access to the cervix. Then, a specialized instrument called a colposcope, which looks like binoculars with a light, is positioned outside the vagina but doesn't touch the body. This device provides a magnified, well-lit view of the cervix, allowing the doctor to see tiny details that are invisible to the naked. Next, the doctor applies a solution called acetic acid, usually at a concentration of 3 to 5%, directly onto the cervix. This vinegar-like solution causes abnormal cells to turn white, a reaction called acetohydrating. Abnormal cells have a higher concentration of nuclei and proteins, which react to the acetic acid by coagulating and reflecting light differently. The doctor carefully observes these white areas, noting their size, shape, and borders. Low-grade changes tend to appear as thin, feathery, and irregular white patches, while high-grade lesions are often thicker, denser, and have well-defined, sometimes raised or nodular edges. The duration of acetohydrating also matters. High-grade lesions usually stay white longer, often 2 to 4 minutes, helping distinguish their severity. Afterward, the doctor may apply Lugol's iodine solution, which stains normal glycogen-rich cells dark brown or black. Abnormal or precancerous areas, lacking glycogen, don't stain well and appear pale or yellowish. This contrast helps pinpoint suspicious regions for further investigation. The doctor also examines the pattern of blood vessels on the cervix, looking for abnormal features like punctation, mosaic patterns, or atypical vessels, which can provide additional clues about the presence and severity of cervical changes. Based on what's seen during the colposcopy, the doctor may perform targeted biopsies, small tissue samples from the most suspicious areas. These samples are sent to a lab for microscopic examination, which confirms whether the tissue is benign, precancerous, or invasive cancer. To standardize and improve accuracy, clinicians often use classification systems like the International Federation of Cervical Pathology and Colposcopy, or the Swede score, which help describe findings systematically. Colposcopy is usually done after abnormal screening results to clarify the nature of cervical changes. It plays a vital role in early detection, allowing for appropriate treatment before any cancer develops. In essence, colposcopy diagnoses cervical changes by visually identifying abnormal tissue patterns and blood vessel features after applying acetic acid and iodine, guiding biopsies that provide the definitive diagnosis. Always remember, if you have concerns about cervical health, consult a healthcare professional for personalized advice and follow-up.